osteopathic medicine is and how it differs from allopathic. Because a lot of people have these questions. And you'll be able to come out of here tonight with some knowledge about what osteopathic medicine is all about. And then I'll talk with you about LECOM, about our school. My doctorate is in medical education from the University of Pennsylvania. And I did all my doctoral work in the area of microvascular surgery education. And when I finished up my doctorate at Penn, I stayed on at Penn. I taught microvascular surgery there for almost 14 years. And while I was at Penn, I also did a lot of research in transplant surgery. I thought that's where I was going to be the rest of my life, in the sexy surgery world. You know, cutting edge of medicine, if you will. Working with FK506, cyclosporin, all these immunosuppressive drugs. I thought that's where I was going to be. Well, one day after we finished a pancreas transplant, I had a very, very bad, very, very tremendously painful sinus headache. And the thing you need to know about me and sinus headaches, I've had them all my life. And every time I went to the doc, all they would do is prescribe medicine that makes me sleepy, but never really took care of the sinus headache pains. And so when I went home to see my family doc, he's an MD, by the way, and he was not there that day. His partner was there, who was an osteopathic physician. I honestly did not know the difference between an MD and DO. I honestly did not care. Well, I wanted someone to take care of my pain. So I explained the whole problem about my sinus headaches all my life and the medicines that I was on. At that time, I was probably on every sinus medicine there ever was created. And I was really beginning to become sensitized to all this medicine, to the point that if I took a Sudafed, probably wouldn't bother anybody in this room. I'd probably sleep for 3 days. And so I explained this to the osteopathic physician about the problem with all these drugs. And he said to me, okay, what I want you to do is get up on the examining table. And he laid me back down on the examining table, and he did some osteopathic treatment on me, around my forehead, my eyes, my cheek, my throat, my neck. He did this for about 15, 20 minutes. He then sat me up, and he said, I want you to come back tomorrow and make another appointment to come back the following day, and I'm going to do the exact same thing on you. So I said to him, well, what should I take for my sinus headache? He said, take your butt, put it in the car, and get out of here and come back tomorrow. Well, I'm at the desk trying to make appointments for the next 2 days, and I'm starting to get pissed off. You go to a doc, he plays with your head a little bit, he doesn't give you any kinds of prescription for the pain, and he wants me to come back tomorrow. Probably not going to happen. And as I'm driving away, I was getting even more aggravated that I wasted time coming from Penn for this guy to do this to me. And I was at the point that not only am I not coming back tomorrow, I'm not canceling, and I'm looking for a new doc. Well, about 15, 20 minutes later, I could start to feel all the sinuses draining from my head, and my headache gone. Well, now it's a little different situation. Now I'm definitely going back to see him, because for the first time, somebody's actually taking care of my sinus problem. I went back the very next day. He did the exact same thing on me. Went back the third day. He did something a little bit different. He educated me. He explained to me what he was doing and what I need to do in the future to prevent these sinus headaches from coming on. So he did 4 things. He treated me, did not prescribe any medicine that was going to make me sleepy, because I already had a history of that. He educated me, and the most important thing he did, he introduced preventive medicine into my life for my sinus headache. Well, I was all excited about osteopathic medicine. I went to Penn's library the very next day and trying to find out as much as I could about osteopathic medicine. Now, Penn's library was 4 floors, and this was pre-internet days. Anybody remember pre-internet days? Anybody remember something called a Dewey Decimal System and a card catalog?
I remember that.
There you go, there you go. You're older than you think, right? Well, that's what it was back in those days. And so I went to Penn's library and I got the card catalog looking for information about osteopathic medicine. And it states in the card catalog that there's about 40 different books about osteopathic medicine. Yes, I hit a home run. I can find out all kind of information simply because of what it did to me. So I write down three or four titles, and I go to the elevator, push the elevator up to the 4th floor where they were located, and guess what? The elevator wasn't working. So I run up to 4th floor, go to the shelf where they're supposed to be, and they're not there. I have to run downstairs, run over to the card catalog. I had to do this for almost all of them. Now, I'm sure these books were in the library. There's no doubt, I'm positive they were there. They were just not where they were supposed to be. The library was a mess. You could not find anything. And so the more I did not find, the more I wanted to find. I became a man on a mission. And the mission was to find out as much about osteopathic medicine as I could, simply because of what it did to help me. About 3 weeks later, I looked in the Philadelphia Inquirer on a Sunday, and they're looking for an assistant dean for academic affairs at the Osteopathic Medical School in Stratford, New Jersey, 20 minutes from my house. Hell, I never even knew there was a medical school there. But because I was really wanting to find out as much as I could about osteopathic medicine, I figured if I apply for this job, they'll send me all kinds of information about osteopathic medicine. I have no idea why I came up with that idea, but that was my thought. So I applied for the job. And about 2 weeks later, my wife calls me, the Department of Surgery at Penn, and she said, "You got something in the mail from an osteopathic medical school in Stratford, New Jersey? Is there one there?" I don't know, they say there is. I said, "Is it a big package with all kinds of stuff about osteopathic medicine?" She said, "No, just a little flimsy envelope." I said, "Well, open it up and see what's inside." Well, what they did, they wanted me to come for the job interview. Well, I really had no thoughts of ever leaving Penn. That was the greatest place in the world to work. So I never thought of ever leaving Penn, but I'll go for the job interview because I can find out more about osteopathic medicine. So I did. Job interview, my interview was on a Friday morning at 10 o'clock. Supposed to be from 10 to 11 with the dean. Well, I got there right around 10 o'clock, and the dean and we chatted. And I met the assistant deans, and I met everybody in the office. Next thing you know, we went to lunch together, and then we walked around the campus together, and then we went for ice cream together. And then about 3 o'clock that afternoon, the dean said, "The job is yours." So I really don't want the job. Thank you very much. But I want to get as much information about osteopathic medicine simply because of what it did for me. So he said to me, "Well, why don't you come here this Sunday? We have an open house." And at the open house, what you get a chance to do, you get a chance to sit in a couple lectures, talk with some faculty, talk with some parents, and talk with some students who are going to be starting their very, very first day of medical school on Monday morning. He said, "If you like it and you want the job, you call me Monday morning. The job is yours. If not, have a great life." Well, that was fair. So I went there, went to the open house, and I sat in on a couple lectures. One lecture really turned me on. It was on osteopathic principles, practices, and philosophy. And in this particular lecture hall was probably 130, 140 people. Parents and grandparents and medical students could be starting the very first day of class on Monday morning. And the lecture was given by an osteopathic physician. Well, about 10 minutes into her talk, in the far right-hand corner beyond front, there was a couple. I used to say an elderly couple, but they were about my age, so it really wasn't an elderly couple at all. And the mother that was there of the medical student, who was starting the very next day, she had a very, very violent hiccup attack. So after about 10 or 15 seconds, the physician up in the front went over to her and asked her if she okay, and she says yes, and she was so embarrassed, and her son made her in a pretty shade of red, being embarrassed. So what happened, the physician asked her, "Are you okay?" And she says to her, "I'm sorry for interrupting your lecture, but I have hiccup problems. I've had them all my life. They come on very sporadically. Sometimes they come on for a couple minutes and stop. Sometimes they come on for hours. Sometimes they come on for days. The longest was 11 days straight with hiccups." So the physician said to her, "Well, have you been to a doc for this?" She said, "I've been to all kinds of docs. All they do is prescribe medicine for me that makes me sleepy." Exact same thing that I went through. So the physician said, "Well, would you mind if I treated you?" And she says, "What are you talking about?" Anyway, so she escorted her to the front of the room, put her on one of the examining tables, started to do osteopathic treatment on her in a very, very specific part of her body. And within 30 seconds, her hiccup stopped. Well, this lady's flipping out. "Where have you been all my life?" So as she's escorting her back to her seat, she said to her, "Why don't you and your husband make an appointment to come and see me?" And what I will do, I will teach him how to take care of your hiccup problems in the future using osteopathic treatment. So 4 things took place. The patient was treated, nothing prescribed, education was took place, and preventive medicine was introduced into that family's life for a specific problem, for a hiccup problem. Now this lady, she could drive a car, she couldn't do too much. Because when this hiccup thing came on, it was a dramatic hiccup. It really, really was. So that's a little bit how osteopathic medicine works to treat patients versus allopathic medicine. You just give them the pills. Now I'll give you another example of how osteopathic medicine differs from allopathic medicine. After a mother gives birth, female gives birth, if she's not interested in breastfeeding, usually what happens, the doctor will give her some pills or injections to drive the milk in her breast. Now, having a wife and 4 kids, my wife had all kind of chemical problems after giving birth. The blues, the whole thing, her chemicals were really, really screwed up. And so getting into one of these sexy drugs probably did not help the matter. So if she went to an osteopathic physician, they would have probably done something a little bit different. What they would have probably done is tell the mother that on the way home from the hospital, stop at a Publix. Is there a Publix here? Publix? Okay. I gave this talk out in Berkeley, California, and I said to them, you stop at a Publix. Well, they had no idea what Publix was. They thought it was a porn shop. Anyway, so you stop at a grocery store and get yourself a head of cabbage. And before you go to sleep tonight, put some cabbage leaves in your brazier. And when you wake up the next morning, your milk will be all dried up. It's a very holistic way of treating a patient. About 2.5 years ago, I went up to Pennsylvania to see my mom. In fact, I put her in a nursing home at that time. And I ran into one of my friends that he and I grew up with. He and I did everything together. Whatever I was, he was. Whatever he was, I was. We did everything. We were on the same baseball team and everything in Little League. And I saw him for the first time like 25 or so years, and he was walking with a limp. So I said, Bob, what's wrong with your foot? He said, oh, it's that damn fasciitis. I said, what are you talking about? Well, he reminded me that when we were on the same Little League team together, that he could not play every game simply because of fasciitis. On the bottom of his foot, he had a big fasciitis, inflammations. And I said, well, have you been to a doc for this? He said, oh, he's been to many docs. I said, well, what are they doing for you? He said, well, what they're doing is giving steroid shots. He goes every 3 months for steroid shots. It's easing it up a little bit, but eventually it comes back. So I suggest to him what he needs to do is to hobble down to Walmart and get yourself a tennis ball. Put the tennis ball on the floor. Put your foot on the tennis ball and roll your foot over that inflammation. And break up that inflammation. The body will be able to consume it a lot easier if it's in smaller pieces as compared to a big glob of inflammation. So what you need to do is do that and for about 15-20 minutes, and then you have to do this every day until this inflammation goes away. He said, it won't help. Try it. So anyway, he called me 2 days later. He said, my foot has never felt so good. So I said, so, okay, what you need to do now is introduce preventive medicine into your life. You need to put that tennis ball on the floor the 1st and the 15th of every month. And you've got to stop that inflammation from coming back and from growing back. He said to me, okay, so I saw him back in right around Memorial Day this year. And I saw him, I said, how's your foot feeling? He said, well, he doesn't walk with a limp anymore. And his liver functions are coming back to normal since he's been off steroids. It's a very holistic way of treating patients. Sometimes pills work great, sometimes there's other things that can be done in conjunction with pills or in place of pills. That's a little bit how osteopathic medicine works versus allopathic medicine. Now, osteopathic physicians are licensed physicians. They can write the exact same prescription as an MD. They can do surgery. They can deliver babies. They can be psychiatrists. They're exact, whatever an MD is, a DO can be the exact same thing. In fact, most of the time, probably 65% of the time, they do the same residency program together. And that's a little how